Ms. Tripoli, can you discuss the impact of the enhanced subsidies in the Inflation Reduction Act on coverage and how many new individuals have gained access to coverage?
Absolutely. Thank you for the question. I think as you just articulated, we've saw record enrollment in open enrollment this year, over 21 million people. That's 5 million more this year than last year's open enrollment. And I think the enhanced subsidies played a critical role to lower premiums for the American people so that when they went in and shopped in the marketplace, they could actually get a plan for $10 and could afford their health insurance. So the premium subsidies have been absolutely critical in terms of the affordability of people being able to afford their care and feel like they can actually purchase a plan.
Thank you so much. The enhanced subsidies in the IRA have led to historic coverage gains. Because of the enhanced subsidies, millions of families have affordable and quality health care. The expanded subsidies are also driving down costs. Can you also briefly discuss the impact of the enhanced subsidies on premiums and how it is lowering costs for American families?
Absolutely. The enhanced subsidies essentially helped shield consumers, absorb some of the growing costs of premiums, and shield consumers from that excess cost. So it brings their actual price that they'll pay for their premiums down. It does, of course, not address the underlying drivers of what's driving up healthcare premiums, which, as we know, hospital prices and drug prices are a major factor. But the enhanced subsidies are critical for making sure that the American people can actually afford their premiums and brings down the premiums for families.
Now, these enhanced subsidies are set to expire next year. Can you discuss the importance of making the ACA enhancements permanent?
It's absolutely critical. More than 21 million people afford in open enrollment getting healthcare coverage. We know that healthcare coverage is essential to keep people financially secure, to make sure that they get the preventive care that they need, that they're not delaying care and going to higher cost care centers down the road, making sure that workers can show up to work healthy, take care of their families. So a permanent extension of those subsidies is essential to make sure that we continue to have affordability for the American people.
So comments or claims that the ACA has raised healthcare costs. Can you comment about that? How you feel about that?
Some of my colleagues from CBO and economists might want to comment, but I think that we have seen underneath the hood of the healthcare system costs increasing. And I think what's important to note here is that subsidies are critical for the American people to access premiums. But what's underneath the hood of the healthcare system are pricing abuses driven by big healthcare corporations that are driving up premiums year after year because they're allowed to consolidate market power and increase prices year after year. So those prices have a direct relationship to rising premiums and have a direct impact on the affordability of care and the overall cost increases in the healthcare system.